Good morning, good afternoon, and good evening, everybody. It's afternoon here in London. And welcome to Adam and also to Mr. Shi, who I'll introduce in a minute. I'd just like to start the session with a bit of an overview of our research paper. And we've heard so many elements this morning already, which touch on the things that we've written in the report. So tackling the topic of vaccines was an enormous challenge, and we were lucky that we were supported by two research assistants in Taipei, Carolyn Fried, and Sue Huang, who are online and desperately taking notes as we speak. And they helped to navigate what was a vast range of literature and opinion on vaccines in Asia Pacific. I think the report is in the chat for the participants on this call. I just want to focus on a few quick aspects as part of the report. So firstly, the report focuses on vaccines as part of resilience, and resilience being the ability for Asia Pacific to adapt, evolve, and innovate. And this proved a really important framework as we looked at the issue of vaccines, because it helped us focus not only on the challenges, but on the solutions that were also emerging in the region. So from this perspective, we see vaccines as the foundation for resilience in Asia Pacific, especially as COVID-19 becomes endemic, which was discussed on the previous panel. Vaccines contribute obviously to saving lives, but they also contribute to how health systems cope during a health challenge. And they also, as we've seen throughout the pandemic in just about every country, they also impact on economic and social systems in all countries. So therefore, inequitable distribution and challenges in vaccine rollouts can really negatively impact on health, economic and social resilience. Because of the challenges in the Asia Pacific in sourcing vaccines, some interesting policy innovations emerge, which we note in the report, which speak to how the region is adapting. For example, secondary markets are emerging, these existing through bilateral donations, swaps, and procurement of excess doses. However, in our report, we also note that it's important that these kind of secondary mechanisms complement rather than compete with global redistribution mechanisms like COVAX. Secondly, as we know and has been discussed on the previous panel, drug and vaccine production is a complex process, also globally concentrated. The challenges of manufacturing in the face of a pandemic and very high demand, I think, are well known. However, as our report notes, the manufacturing capacity is extending across the region, and this was also spoken about in the previous panel. This extension is the culmination, obviously, of private sector agreements, but also the overarching support and long-term investment in policy frameworks, particularly science, technology and innovation frameworks, and as well as economic development frameworks. So as many of the contributors to our report noted, there are benefits in the region of extending this activity with a focus on agility. Countries with smaller populations in Asia Pacific that can manufacture are probably going to be quicker to be able to vaccinate and look after their own populations and then export regionally and globally as well.